Hello, welcome to my Steven Johnson syndrome presentation. Steven Johnson syndrome is defined as a form of toxic epidermal necrosis. It's a life threatening skin condition in which cell death causes the epidermis to separate from the dermis. The syndrome usually affects the skin and the mucous membrane. These are few type of effect on the skin causes by the Steven Johnson syndrome. The most common cause of Steven Johnson syndromes are medication and infection. Cancer, AIDS, influenza, hepatitis, mumps, and genetic factor can also be associated with it. In children, Steven Johnson is mostly caused by an infection like the upper respiratory infection, otitis media, and pharyngitis. About 25% to one half of the cases of Steven Johnson syndrome are unknown. Steven Johnson syndrome can start with a flu-like symptom, fever, sore throat, and fatigue. That is followed by a painful red or purplish rash that spread all over the body, and blister can also be seen. A symptom can appear in the mouth and lips, also in the genital area and anal region. In about 30% of children who do develop Steven Johnson syndrome tend to have an inch of rash that can appear in the face, trunk, arms, and leg, and sole of the foot. This right here is a picture that shows some rashes on this child face. For testing diagnoses, a physician can do a physical exam. Often they can identify Steven Johnson based on the patient medical history, a physical, and the disorder, sign, and symptom. Also, skin tests can be done to confirm. The doctor may remove a sample of the skin for laboratory testing. There is several type of treatment, usually for Steven Johnson syndrome. For Steven Johnson syndrome, it's a medical emergency. That the patient need to be in a burn center or intensive care unit. If a medication is the cause, the medicine has to be discontinued immediately. Pain medication is used to reduce discomfort. Antihistamine is used to relieve itching, antibiotic for infection, and some topical steroid medication to reduce the inflammation. Other supportive care of treatment that can be done is fluid replacement and nutrition through a nasogastric tube, wound care like cool wet compress for blisters, and doctor can also remove any dead skin from an infected area. Eye care may also be part of the treatment if eyes are infected by Steven Johnson syndrome. A recovery period for Steven Johnson syndrome can take week to month depending on what is the cause of the disease and how much of the skin that is infected. These are some of the nurse's diagnostic. For example, impaired skin integrity related to inflammatory dermals and epidermal. Risk for infection related to the breakdown of the skin barrier. Some of the interventions are to observe the skin turgor, the circulation, sensory, and to look for any other changes that may occur. The reason is to determine the baseline by looking at what changes in the status, and they can be compared. So when evaluation is done, new implementation can be taken easy. The use of a thin and soft clothing can help reduce irritation of the skin and pressure. Using sterile procedure related to preventing infection due to the breakdown of skin barrier is very important for wound healing. These are some of the NCLEX questions. I'll let you read it by yourself. I provided the right answer down here. This is another one. And this is the end of my presentation.